right, back with Marc Haddle. He's a co-founder of DataSolids. Man, this guy, when I talked to him the first time, like this blows my mind. The idea of us owning our own data, because for one thing, for me, like I feel like the reason the healthcare is kind of fallen apart in the United States, and I work in the healthcare system, is that the consumer no longer has any kind of say. Our money doesn't go
No.
directly to the provider, so we have not much of a say. And I've thought, like, how do we return capitalism to the healthcare industry? But you're talking about doing this not through money, but through possession of your data, which is such a different angle and such a brilliant one. And there might be even some ways to capitalize on that. So carry on, my friend.
So basically, yeah, it all turns to, boils down to who has control or who has possession of that data. Right now, as we've said before, your health data is not the patient's exclusive personal property. It's also the output and work product of a lab or a provider, and they have a valid claim of ownership as well. It's who has possession of it, who has control. And right now, that's never the patient. And right now, we do realize that there is a burgeoning and rapidly growing data economy out there. We've heard for the past 10 years, data is the new oil. And I'm like, yes, it is. Many platforms or, particularly social media, accounts that people will set up and, participate in. I'm like, you didn't pay for that, did you? And they're like, well, no. And I'm like, if you're not paying for the product, you are the product. They want your data. They want your clicks. They want what do you hover over with your cursor? They want to be able to find out as much as they can about you as well as people like you. And so that's how they want to encourage you participating on their platform, because they want you there, present, generating new data, which they're going to, of course, de-identify because they have to, but they're going to package it. They're going to aggregate it with several other people that are similar to you, and they're going to sell it to data brokers. Um, and this happens millions of times a day. And right now, the most recent metrics that I've seen, late 2023, that the health data marketplace is about $50 billion right now, but it's growing at a CAGR, a combined annual growth rate of around 24%, just under. And so if you just kind of look at this, by 2030, this is a $130 billion marketplace, and the patient has no place at that table, but they are the origin for pretty much most of that data that is out there. We need to know, what is your body data like, or even your self-reported type data, your social determinants of health, even the things that you have on your wearable. Right now, that's non-clinical information, non-clinical data, but it's incredibly useful for for health, for exercise, for fitness, anything that people are going to basically use their wearable for. And
Yeah,
so,
can I dive into that a little bit? So,
yeah.
for those people who don't really understand artificial intelligence and large language models, like, we started with these big models that are trained on the entirety of the internet, and then use human factor reinforcement learning, which used to be third world countries and people getting paid pennies a day just to say this is pornography or this isn't, right? Well, that economy has come down to where the model differentiator is like subject matter experts getting paid 85 to $185 an hour to do that human factor reinforcement learning. The next step of that is going to be clean data sets. So rather than training
Ooh.
on like what everybody said in Reddit about how to get rid of warts, right? You're going to actually take patient records that, if you had possession of your data in a pod type cloud like you're talking about, I
Well,
could sell to a large language model. Yes, you can train on my data, and for X number of dollars. And I think that is going to be a huge economy.
Well, and it's not just possession of your data. It's just that now, that as the patient, you now have better data than anywhere else, because it's all complete, it's all harmonized, and it's current. I mean, that's another thing, is when it comes to health data, if it's your clicks and your Netflix accounts and stuff, it's one thing. But when you're dealing with actual health data, patients are a lot less comfortable with other people holding it. They
Yeah.
realize there's nothing they can do about it, but more and more patients are getting aware that, hey, I'm seeing all of these new announcements involving AI in healthcare. We saw with ChatGPT just for health, and Claude for health were just released a few weeks ago.
Pause
And
there. That's a great place to pick up on the next one. I want to talk about ChatGPT and Claude Health.
perfect.